So good evening, everyone, and welcome to Parent as Coach, helping navigate your child's oral health experiences. My name is Juliana David, and I'm a program director at the New Jersey chapter, American Academy of Pediatrics. This initiative was funded by an Inclusive Healthy Communities grant from the Division of Disability Services, New Jersey Department of Human Services. As a friendly reminder, the recording and any resources provided will be shared in a follow-up email. Before we get started, I would like to go over a few housekeeping items. Today's session will last 1 hour and all attendees will be muted throughout the webinar to minimize any disruptions to our presenter. If you have any questions for the Q&A portion of today's session, please submit them through the Q&A box on the webinar control panel located at the top or bottom of your screen. If we did not get to answer all the questions, we'll compile them and provide an answer after the event. Please be courteous, respectful, and professional when asking questions and posting your questions on the Q&A box. This time, I would like to introduce our esteemed speaker, Dr. Brunima Hernandez. Believe it or not, 2 years ago, we reached out to her around May, and we asked her to speak about oral health and COVID-19. And guess what? We invite her back. Why? Because we love her. So I would like to introduce her, and so you can get to know her. Dr. Hernandez is triple board certified in pediatric dentistry, applied behavior analysis, and a health and wellness coach. She has been serving the community of New York and New Jersey for over 30 years. Dr. Hernandez received her education in pediatric dentistry and a Master's of Art at Columbia University College of Dental Medicine. After serving as an assistant professor for many years in the Department of Pediatric Dentistry, she decided to pursue a career in the clinical practice of pediatric dentistry. In 2005, she established her own office in Fair Lawn, New Jersey. Then she pursued a master's in applied behavior analysis. While she delivers care to all children, her special interests are treating children with special healthcare needs, behavioral disorders, and phobias. To better understand the lifestyle factors and how they influence health, she completed her functional medicine training at IFM. She continued her journey to become a board certified health and wellness coach from the FMCA. Learning only creates an opportunity to learn more. Sleep, an important determinant of health, is her new deep dive. So, knowledge supported by science from these disciplines allows her to take a whole body approach to promote overall wellness in the children she serves. Her favorite term is bio-individuality and brings a biological and person-centered approach to every family child diet. So welcome, Dr. Hernandez.
Thank you. Thank you. Should I get started?
Yes, thank you.
Thank you, Juliana. Thank you so much, everyone, for spending this evening with me. It's a nice small group, and it's a very varied group from few. I'm sure people will join in. There were parents and agency people as well as pediatric dentists. So we have a very variety of people. But this lecture, when Juliana and Nadia asked me to prepare for, we wanted it to have a very parent focus. So we all can learn from this. We are all parents. So I'm sure we can take some elements of this to our practice, but we also in agencies and as pediatric dentists, we might be dealing with parents. So understanding what they go through is really important. I also wanted to thank Juliana for the title. The title includes the word experiences. When we are in healthcare, we think about a disease process, correcting it, cavity, filling it, pain, but we don't think about the whole overall experience. And I loved that concept. So I am hoping to really broaden that concept and what that means to me. This lecture is really a little laid back, not talking about statistics, but more about clinical practice and my own journey as a parent. So it's very near and dear. So I'm starting with this saber-toothed tiger, and you're wondering, what has this got to do with dentistry? When we go to the dentist, oftentimes the scene looks like this little video that I have. So let's watch this video together. It's about maybe under a minute. So I took this video laying down one day from, I laid down on my dental chair and I had my assistants work with me. And that was really scary. From a patient's perspective, and you've laid in that chair, this is a very scary scene. And imagine working with children with special needs. Laying down is hard as it is. So the fear response is incredible. Even though our offices can look very beautiful, like a bedroom with this little lamp and everything set up very nice with nice, bright, nice, light, dull colors. Dental environments can be very, very challenging. But we know dentistry is necessary. It's necessary throughout the lifespan of this individual. Regular checkups, which is to rule out issues, to clean teeth, and to provide that anticipatory guidance, is really important. But it isn't the most pleasurable of procedures. For many of our very sensitive clients, the smells, the taste, the lights, the sounds can be very invasive. And it's a very fast-paced environment. Unfortunately, that's the reality of the business. We have several schedules running, the offices are busy, and everything moves really fast. The procedures are not necessarily comfortable. We know that. We've all experienced it. And oftentimes, the history of negative experiences can cause long-term issues. As we say, what happens in Las Vegas stays in Las Vegas, but what happens in healthcare does not stay, it stays with the person. And that is why that experience really matters. So people might experience fear, and fear is a label for a set of behavioral responses, and how a child responds could be very different. There could be children with special needs who may not have any fear to some of the instruments, and there might be children who are neurotypical and be extremely fearful and be crying. But looking at the body is really important. Look at the shoulder moving up. That is sort of a response. They're all curled up and the legs are not flat straight. And sometimes in children, these are children who may not even have a gag reflex, but you can see the body responding. It's a physiologic immediate response. And so working on making this fear response to something a little bit more comfortable has become my journey. So a lot of parents will come into the office and for simple cleaning, a routine, simple cleaning, and there might be a huge behavioral response, such as not even entering our office space. And parents will wonder why. It is just a simple cleaning. It is okay. It's just a cleaning. It doesn't matter what we think. It doesn't matter what the dentist thinks. It doesn't matter what the parent thinks. The only thing that matters is that child's perception. And changing that child's perception is extremely important. So a large part of this lecture is about that, changing that that perception. Not only are the children afraid, the parents, when we walk into these appointments sometimes, and I am a parent of a child with a person with a disability, and I'll share my story in a moment, we could be anxious. We may have had previous disappointments, fatigue, and burnout. And so, if we take nothing else from this lecture, focusing on our wellness as parents is extremely important. Like they say in an airplane, resuscitate your body first, yourself, before anybody else. Focusing on our wellness is really important so that we can carry our children all through their lifespan. So this is, again, a very varied audience. It's a small audience right now, and I know that this is being recorded, so a lot of different people will be listening to this lecture. For me, just like these different leaves from my garden, my success for this lecture would be if you can even take home 2 little leaves from this presentation, as they say, 2 pearls. That would be fantastic. So I'm going to share my story. My son was born with a very dramatically I was 6.5 months pregnant. He was born at 24, I think 24, 25 weeks. And he was very ill. He was born a pound. And it was a very, very, very fearful day. My husband and I were very alone. We were fearful. There was such extreme grief. And we didn't even realize how much grief we would feel. We had no idea what had just happened on this day. I still remember the time of the day and where I was sitting. And this is awkward to say it, but there was a sense of shame, as though I had done something wrong. Why was my baby born so early? And I could not even imagine what that rest of that life would be. It took me days to go down to the NICU to see my baby until my perinatologist said that if you don't go, I'm going to carry you there. And I did. And this picture that you see is when his little hands held my little finger right there. It is when that connection was made, the connection of our forever. Parents become coaches to our children. We know that. We guide our children through so many experiences. But parents of special needs are coaches forever. So he did come out of the isolate. He did come home about 6 months later. He didn't have the easiest ride, I can tell you. And he did grow up. And he's 25 now. And as parents of special needs, children with special needs, there's always this sense of what would our child have been if everything had aligned as it was meant to be. For me, I won't know that, but this card that one of our teachers made for a Father's Day was beautiful. It stunned me because this is my son right here. And I could not imagine all those muscles and him standing up so upright and playing a guitar to his favorite Metallica music. It was very interesting, those emotions. So this is our story. Parents are coming in to our dental offices with a story. And that story, that journey has shaped their lives. And not keeping that in mind for us as providers is something, rather, I would put it in a positive way. Keeping that in mind is really, really important for who walks in. So the story is a very wonderful story, even though my startup wasn't so exciting. This was my first teaching job. I decided after the first year to give up my practice and become completely invested in my son's rehabilitation and my family's rehabilitation for that matter. So my first teaching job was working with my son, and I spent hours and hours. And this is just a little clip of working with him.
Good job. Good boy. Can you show me the sign for deal sign? Yes. Nice. Find the circle. Good job. And find singing opera now. Ready? Put it on top. Good boy. That's where it goes. Sunflower. Mama. Ma. Oh, one more. What is that? It's a. First, put it on top. We gotta get the lead pad. You want the lead pad? Finish it. It's a sun.
So my son wasn't receiving ABA. I didn't even know what ABA was at that time. But it's just it came naturally to me as a parent. And as parents, we just become teachers, teaching every skill, like a yield sign. He would never need the yield sign. He's not going to drive a car, but that is something I taught. This is the same kind of energy that we can bring in to teach some important skills. So, and we will look at that in the future, later in the lecture. Perseverance is another important quality that is, I think, becomes just a natural in a special needs family, so to speak. This doorknob, I still have it, is not an ordinary doorknob. And this is a really, really incredible story that reminds me whenever I start to lose perspective. So we all know this little toy here on the bottom, and you see this little button here, the blue one. I would work with my son. He could press this, rotate this, and not rotate this, do some other motion, but he could never really turn the knob. And I would try, but hand over hand, and he just would not get it. And I couldn't understand, how could he not get such a simple movement? So I remember thinking about it. I used to make all his tools, craft his toys. I thought about a doorknob. I think it must have been 2 o'clock at night. I must have just woken up and this came to me. He loves shiny objects. And how about if I took out a doorknob and I drew lines and he could spin it, and he would love spinning. And so I couldn't wait for him to wake up the next day. And I just offered him this doorknob that I had adapted. And very naturally, he went ahead and turned it. And immediately I presented the toy and he turned the blue with no problem. This doorknob is really meaningless. I know, I get it. But the point is that doorknob and turning allowed turning so many other things. It allows teaching a behavior responses, allows access to other reinforcers. I mean, today he actually understands the doorknob, what it means. He can say it, and it took so much effort and work and coffee and breathing exercises trying to teach him, but it was important. I won't play this video completely, but the point of this video was,
Can you turn that?
it won't let
for
me
me?
go. You'll just see it. Thank you.
Yeah, good for you. What is it?
No,
It is a doorknob. Thank you, buddy. Can you turn
I'm
that
sorry.
for me?
There we go. So the point of this
Yeah.
video and this conversation was that sometimes changing the can't, that we say we can't, the child can't do, or an individual can't do, to can, may require change in strategy. And here he is, that same kind of perseverance and teaching. I brought to his dental appointments, and he's allowing us to engage in a procedure that I would say is extremely difficult for most people, let alone our children with special needs. Scaling is very, very intense.
mm,
Okay, good job. Put your hands down, baby. Hold your belly. Thank you.
mm.
There we go. This is my beautiful dental office. This is where my beautiful team is. And for me and my team, this work is personal. We bring the same perseverance and obsession to every patient to our office. This is a space where parents, I let them know when they walk in and their child may be throwing a tantrum or not entering and they're embarrassed. I tell them you're home and you're safe. It's a safe space. And so I am grateful for my journey, because without having that parent perspective, I would not have been led to my purpose. And my purpose has become teaching wellness. Ikigai is another way of saying purpose. And when I say wellness, it isn't just clean teeth. It isn't just wanting no cavities for my children. I want overall wellness. And that is why I added health and wellness to my background, because we want our children to have full, vital lives. And parents play an important role in this. Just, just like I described my teaching experiences, I am sure every parent on this call or parent that you have met has some component of parent training that they have had to do. So experiences here that we describe are from the perspective of a mother in this conversation. I will bring in elements from the behavioral analysis, and most importantly, introducing elements of coach, parents as a coach. So what do coaches do? Coaches ask a lot of good questions. And most importantly, coaches become excellent listeners before they help develop a plan. So, some of the things that I ask parents, or I would ask a parent when they're serving as a coach, is to really explore what is a successful experience? What is a good experience at the dentist looks like? You know, imagine what that would look like for your child, because we have so many different disabilities that it could mean different things, right? And when we imagine this experience that we want to create at the dental office, we have to have realistic expectations. So that is really important to keep in mind. For me, a successful experience would mean that something that isn't as stressful and it's moving in the forward direction. For parents to think about experiences, they have to think about, should this successful experience mean I want to get the work done with a restraint and that does not matter? Or is a restraint okay? Because very often parents will come to my office and will say, I really did not have a great experience. And I always have wonder. I always ask them, well, what was your experience? And if they said, well, my child was held, you know, we have to know this ahead of time. Is it okay for my child to be held or not? And this is some thinking that we have to do before. And if we don't want them to be held, and let's say a child is not cooperating, what would that alternate strategy be? Here's a question that comes up a lot. The child may have extensive dental treatment and may not be able to sit in the dental chair. And a dental professional may offer some invasive procedures, which include sedations for that treatment. Is that okay or not okay? And if that is not okay, what is that plan to have a successful experience to get that completed? So designing a successful appointment will require collaboration with that health professional, but also realistically understanding how can we design that successful experience. So the coach approach is very different from an expert approach. As an expert over 36 years in dentistry and then I added other fields, it was very much about telling people what to do. And coaching is a lot more collaborative. It is where the family and the profession and me come in and we work collaboratively. And that's what a parent can do as a coach, is have a very collaborative experience. A coach is a facilitator of behavior change. So they help people change certain habits. And a parent can very easily do that in the time that we have at home with our children. No one knows our children better than the parent. What I love about the coaching approach is that it fosters possibility in positive psychology and focuses on what is right. Most styles or educational styles will meet the client where they are. And so preparation is really important. And Everything is delivered with empathy and compassion. So raising a person with disability requires a giant effort. And parents, you know that. Providers, you know that. Collaboration and preparation is at the heart of it all. These are my 5 superheroes. And without them, I could not. But each one of these little circles here are the different people in my son Narayan's life that have come in and contributed to each and every aspect. And collaboration and preparation has been at the heart of it all. So, what can we do? As parents, we can do some pre-appointment collaboration with the dental professional or the office. We can ask to fill out forms in advance because imagine coming to the office, the practice is full, and then filling out forms. Our children might be running around and we may not have additional help with us. And that's really difficult. So getting these forms in advance will just reduce the stress a little bit. Writing a document describing who that child is. I had once written an article with Corinne Catalano on Who Am I? I think it's an exceptional parent. You can look at it. It was really a good way of writing a document from the perspective of the child and describing the person. And a medical summary document is very helpful to have ready in advance. And I'll show you what that looks like. Requesting a pre-appointment brief conversation. Remember brief because these are busy professionals who are seeing many patients. So taking a brief amount of time just to discuss maybe what you're going in for or asking them, how may I best prepare my child for this appointment? May be very, very helpful. If you are going in with, let's say, an emergency or a particular issue, for instance, many children, parents will come in and say, look at my child, he sometimes hit his mouth. I wonder if there's something happening with the teeth, but take a video of it when he's doing it. And when you have that video, and if you shared that in advance with the office, perhaps with the dentist, this could be very, very helpful. And whatever we're talking about is helpful, not just in the dental environment, it could be helpful in any healthcare environment. So this could be part of that pre-appointment collaboration. Create a medical summary. So my son's medical summary is really intense. It's got 3 pages. Well, £1. This was 25 years ago. And so there were a lot of issues. And so I created a medical summary that has his medical histories, his hospitalizations, just the broad categories, medications that he's on, past surgical experiences, what are the therapies he's getting. And this medical summary, I always print out right before I go to an appointment. And when they're ready to take my medical history, I just hand it to them. It's so much easier for people to write down and put in the names in our medical system. Putting in those medications, not simple. We don't know all the medications. So creating this medical summary and then updating it as your child grows every experience or anything that's added, or every 6 months or every annually, is very, very helpful. He's 25 and I cannot tell you how many versions of these medical summaries I've had, and it's cut down so much effort for me over time. So creating this is really important. You can have perhaps a phone meet and greet with the health professional, with the dental professional. And in this time, perhaps, you could very briefly discuss some of the behaviors that have come up in the past, oral care habits, some of the difficulties. Why are you even bringing the child there? What is the plan? What is a simple plan? How can I prepare the child? What are some favorite reinforcers that they can have available or you can bring with them? So this parent phone meet and greet that we have at our office is one of, it lasts about 5 to 7 minutes, but it is jam-packed with information and it goes fast, and yet is powerful because when the child comes in, we have some sense of who that person is, as well as we know how to prepare for them. We know how to prepare for our guests. So in our conversations earlier, Juliana had mentioned that they had focus groups on, what were some of the issues that us parents may be experiencing. Wait time was a big one there. And wait time, meaning in the reception area, it's hard for children to wait. Um, some are okay with it, but some aren't. So I'm going to give you a perspective of the dentist. Life happens. Most of my colleagues, dental providers, want to be on time because we want to get back home also to our children. However, life happens. People come in late. Sometimes an emergency might walk in, and as a result of which, the entire schedule falls back. Sometimes an employee in this day and age after COVID, we're all running on low energy, low gas, and low employees. So running on time can be very difficult on the business end often. So as parents, we can prepare for it. Bring in reinforcers, bring in things that a child likes, preferably non-edible, because if someone is getting a cleaning, you want less instrumentation in the mouth. Maybe ask the staff, are you running on time? If not, I'm going to spin the car around a little bit more. Or ask for an early morning first appointment. You can't run late with that. So wait time, we can think of solutions ahead of time and prepare for them. So this is where we can run into trouble. How many times our children have gone in and just closed their mouth in the past? We know that this is the response that a child may have had with one dentist. They went to another, maybe with another dentist. So if this is what the response has been, we've got to change something. We have to change perhaps our strategy. And why is the child closing their mouth and not sitting is something that we have to explore. Behavior has functional value. Now, my research, my behavioral research was focused on the functional value of behavior in the dental office. Unfortunately, for other circumstances, it was not something that was published, but there was no great revelation that behavior was mostly due to escape function, maybe attention, but mostly due to escape from perhaps fear of the dentist. But just asking the child, those children who can speak, is very helpful. I'm going to run this video because it's a very beautiful video. I haven't seen her I can't remember, but this is probably one of my favorite videos because she had the words to communicate that many of my children that come to see me in my practice aren't able to.
Open a little bigger. Open a little bigger so I can see. You did awesome for that one. I'm going to ask you a question. Remember when I was first cleaning, right? And you moved a lot in that area. You got used to it now, but why were you moving?
Because it tickles.
It tickles. Guess what? When you move so much, I thought you were scared. Is ticklish and scared the same thing or different?
Different.
Different. What's the difference?
You're moving a lot because it tickles. When you're scared, you move more and more.
Oh, so when you're scared, you move more and more?
Yeah.
And when you
But when you're, like ticklish, you just move a lot less.
a lot less. Oh, I love you so much. It's a good thing you're not mine because I'd bite you. You are mine. Thank you.
Okay, I would never bite a child. Okay, but there's that moment that comes up where, it's just, she's gorgeous. But what she said something is, when when you're scared, you move more and more. And that is something to keep in mind, and how we change that is something we have to strategize at home and with our dental professional. So a behavioral response, and we know as parents and we know as dental professionals, and we know as providers what that might look like, will require some behavior change, but it's going to require some extreme preparation. I love this picture. This patient of mine has an extreme gag reflex. And when he comes to the practice, his mom prepares him with everything. She sends a bowl, and now she uses coffee, those bags, those coffee, that the bags that we get coffee in, so that he can just chuck right into that. And I love that, because she comes in with this extreme preparation done already. And this is the kind of preparation that we are going to need. This is my son. I would say about 3-4 years ago, he had a severe seizure, fell and had a concussion, and he was getting an MRI. And we did not want to sedate him. I mean, I would have if he needed to, but they were trying to avoid sedation. And they said, well, let's put him through it and see. And obviously, I was very nervous because I could not be in that tube. I'll be honest with you. I definitely needed sedation. But I figured, let's try. He loves headphones, he loves music. And maybe if I can bring this up on YouTube and show him what that looks like with headphones inside, he might be able to do this 5-minute procedure, right? And so what we did is, all morning in the hospital emergency room, we watched videos again and again. I let him listen to that sound inside the MRI machine many times. And during the procedure, he actually had headphones with music on, and it was incredible how he was able to do it. And even I was shocked with the power of preparation. I'm not saying every child can do it, but it is something that is worth the try. Let me see if this will let me skip the video. Yeah, it did. So what if we bring this same strategy to the dental office as parents? What if we bring the behavior or the child's responses under stimulus control? That is saying, in just simple language, that in the presence of the chair, I go sit in it. In the presence of when the dental professional, I don't have to run. Maybe when they say open the mouth, I just open my mouth. What if we do that? What if we teach these routines in advance, even before the child arrives? And that is what we can talk about. And we will talk about some tools in a moment. So preparing a child for dental exams, what are some questions to ask of ourselves, right? What are some, we can draw back from other experiences in this child's life. We can talk about what strategies have worked in the past. Remember, coaches ask good questions, and based on those questions, we can make a plan. So what strategies have worked in the past in other healthcare environments? It could be that every strategy failed, but maybe something worked. How were doctor visits when the individual was very young, and have they improved? And most often, when I ask this question of parents, how were the MD visits? They'll say, well, they were really, really tough, but they've gotten better over time. That's because the child or the individual has had an opportunity to go to visit the doctor many times. The dental visit happens once in 6 months, and even that is very often skipped. So the more often we go, the better, the more chances of trying this appointment. And what did a good appointment look like for that individual? Of course, this will depend on ability and disability. There might be children who are not able to move. They may be in a wheelchair, and it may be completely different. So, preparing a child requires asking and drawing from our past. What were those environments where we had some good experiences, and what worked for this person? Collaborating with our educational programs is something I would say is extremely valuable. As parents, we are very busy, not only taking care of this one individual, but taking care of our family and ourselves. So I am so grateful for every educational professional that has been in my life. And when I mean education, I don't mean just teachers, I mean every therapy that has been, because I would not have this boy and me sitting here talking without their help. So I have extreme gratitude. But getting professionals to teach children their brushing programs at school, maybe getting that one brushing done in, even simulation of a dental visit in schools is being done. Um, Here are some preparation tools that we can that are quite well known now. When I started to lecture about this almost 20 years ago, social stories, video models, picture schedules, simulating dental visits in the home environment was very novel. It was almost emerging sciences, but it's very well accepted. And social stories are like a picture book. So going in, remember the pre-collaboration we talked about with the dental professional, getting pictures from their offices, putting together in a book and showing them these pictures, getting tools, buying them a dental mirror, and preparing the child by actually putting these different tools in the mouth is simulating what we do as dentists. Because some of our children just may not understand what is happening, and the environment could be very threatening. So simple things such as a cleaning, which is really a rubber cup filled in with yummy toothpaste, well, kind of yummy, gritty, is not as simple for a person with with let's say a particular special healthcare need. We have to teach these responses, or we can try to teach these responses and then make it experiential for them to get it. And the repeated exposures, repetition, 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 will help with the habituation and less fearful at the dental office. Generalization is these practices at home might help in generalization, but I think having a plan for generalization to the office is really important, because I know that for many individuals, let's say on the autism spectrum, they may get used to that tool being tried in the house by a teacher or a parent. But coming to the dental office is a whole different environment that they have to get used to. So planning with that dental professional, on how can we generalize this is really important. Planning with your team members is really important. Perhaps speaking to a therapist, or a school teacher that can accompany, who has been working with this child, can help in as a mediator in generalization of skills to the office. Otherwise, we still may run into some problems. So here's some video models. It's like video models are like virtual visits, except they are not 3D. You cannot touch. And this is just how I teach my patients
Hi,
to
Sophia.
use it.
Today
This is
we're
a video
going to
model,
count
and
your
here
teeth
is one
at
of
the
my
dentist.
patients watching
The
the video
dentist
model. In
wears
fact,
a
it
mask,
became one of her favorite reinforcers.
and the dentist
And she
also
would,
puts on
the
gloves.
parents would say that this is what she would choose to work with, and it's pretty cool that way. But virtual visits are important because in this day and age with COVID, the in-person visits are very difficult. In-person visits are very difficult in general, because if the reception area is very busy, it becomes extremely difficult to accommodate so many people in the reception area, because a lot of people want that as practice. So video models can be a great way to bring that same experience to the home environment and to be practiced repeatedly with the individual. Teaching a breath response. So this is one of my favorite things that I added a while ago, is when children are fearful, when we are fearful, and we are fearful. Actually, everybody's fearful when it happens. Even the dentists are very anxious about what is happening or what would happen. I think the breath response is fantastic for everybody. We have breath teaching response papers that are placed in every room, outside every room. And it used to be in the reception area. I can't remember if it's there, but working with children who I'm able to, but teaching them how to breathe. We don't teach children how to breathe. And that's such a great coping mechanism to reverse the anxious breathing. And let's just watch this video. All right, lovies, this is what I need you to do, okay? I want you to use your nose and then take some breaths and push it right into your belly. Ready? Slowly. 1, 2, 3. Wow, I saw it here. Again. 4, 5. That was amazing. You're a magician. Thank you. So why not teach this in the home? How often have we as parents taken our children to an appointment? It doesn't go great, right? And then we say, breathe, just breathe. Well, the child doesn't even understand what breathe means. But if we teach the breath response, whatever that might be for the child, they're more likely to use it. So I really find that to be very helpful for our children. And preparing the inner environment. So in my behavioral journey, we were very much about concerned with the external environment. But I am a healthcare professional, and the inner environment is important on how we feel. So for appointments, I oftentimes will speak with parents and talk about, eat, clean up the diet. Let's focus on nutrition. Let's get the child to sleep well before an appointment that we know is going to be challenging. How many parents do we have in this group, regardless of individual special needs? Think about those times when we had our babies and we were so sleep deprived. Oh my gosh, we couldn't even think, right? So sleeping well before that major stressor is important. Avoiding other stressors. So oftentimes we have few days off, let's say from our job, and we as parents will put in all these appointments one after the other to utilize that time off, getting these appointments off the way. I get it. It is convenient, but convenience may not necessarily be so convenient or good for the behavioral responses of that individual for a very difficult, let's say, dental environment or dental appointment. So avoiding those major stressors is good. Teaching them stress management exercises, and parents, self-compassion. It's okay if it did not go well. I think we're very hard on ourselves and we want it to go well. Maybe we can go back to square one and plan how that other visit could be better. Coaches help build self-efficacy. It was a term that was proposed by Albert Bandura, which refers to an individual's belief in the capacity to execute behaviors necessary to produce specific performance attainments. That means a person believed that, yes, they could do it. Now, for many of our children, self-efficacy to me is building independence to the extent possible. And for that, preparation is extremely important. Hence, I've focused so much on collaboration and preparation because when we talk about healthcare experience, it isn't the burden only of that individual who's going to provide the healthcare. It is really bringing a collaborative effort of which parent is the coordinator and the head of it all. At the dental, so this was a little bit pre-appointment, but at the dental appointment, and I'll go a little bit faster, is bring their health tools, bring their toothbrushes, toothpaste, bring headphones, bring the sunglasses, write your questions down in advance, because with all that hurry scurry, and maybe the child doesn't do it that well, we may forget those important questions that we've been waiting to ask, and then not having that in person. So write those questions down in advance. Maybe let the provider know, I have these questions, please, would you be able to answer it before, after? Inform them, if the waiting is difficult and they have a long waiting period. Ask the provider, how can I help you during this appointment? Where would you like me to be? Would you like me to be in the room right here? Or would you like me to help you gently hold the child's hand? How may I help and support this visit? And provide the support as needed. If the person is sensitive, have those post-appointment conversations a little bit away from the room. Recently, I had a person who, with extreme anxiety and phobias, but had very good command of language. And we were talking about tonsils. And I was calling out to my scriber, and I said, tonsils are slightly enlarged. And I went on, and the child just completely had a meltdown. He thought his tonsils were coming out at that moment. So we don't know what children understand, what they hear, and what sense they make out of it. And very often they do. So speaking outside of the room may not be a bad idea, as children could be engaged during that time with TV or a cell phone walks everywhere, and it's helpful. From a dental perspective, I must share this because I'm very, very partial as parents, being a parent of. I think that to me is very close to my heart. But I'm also a dentist, and I would love to bring my colleagues' perspective. During COVID, I don't even know how I did this work, covered with layers and layers of PPE. But generally, appointments can be very challenging, just like it is challenging for the child, it's challenging for the parent. It can be very challenging for the person delivering that healthcare, because that traditional appointment slot that is given is really not enough. For even the whole day may not be enough to get the work done sometimes. And it's just not enough to carry on a practice. And behavior is unpredictable until it becomes predictable, and becomes predictable with exposure and habituation. Our insurances, unfortunately, do not reimburse dentists for the time that they might take. So if no work is done, there's absolutely no income generated. And this is something that maybe as parents and as agencies, we may have to, lobby and change things, but it hasn't changed as of yet. Oftentimes, our dental visits might be elective, but they might be an emergency. And there's a difference. If there's an emergency, the person may have to be held down because you need to get in and see the work. And this visit happens biannual, so the experience isn't just often enough for the child to become habituated. Let's face it, as therapists, as behavior analysts, we work for years on target behavior. And as healthcare professional, we get that sliver little moment in time. So we have to be really real about this. Also, as parents, we know we can't prepare for every procedure, and our child just may not be able to do it. It is impossible to prepare every sensory component that is needed that happens in a filling. I'll never forget one clinic had asked and called me and said, we want to prepare one of our children for this and this. Could you please tell us? I said, well, I can tell you the general outline, but not every moment could be rehearsed, right? It's not about talking to a child when we are preparing them. It's really letting them feel the actual feeling of that they have been through the dental appointment, but with mommy dental appointment or daddy dental appointment. And a single presentation may not do it. So when we say that I've been talking to my son or child or my daughter about the dental appointment, talking may not just be enough. And Of course, they're not going to learn when they've experienced that extreme anxiety and panic at the dental office. We don't learn. We have to escape, fight or flight. Frequency of visits, we may need to be going more often. And I know financially that is a burden, but it has to be individualized to the need of the person. That initial investment has a long-term payoff, and home exposures are a prerequisite between these visits for individuals who are very, very fearful. And dental care is just like body care, it travels with the person. So, no matter where we are with our son, hospitals, our dental care is primary. Oral care behaviors are we're very familiar with. I'm going a little faster. I'm sorry. We're getting to the end of our time, but these are some behaviors that are typically, talked about. Brush several times a day, at least two. I've always wondered why two, why not more, and where did the number two come from? And with this new age of how we eat, which is very frequent, is two enough? Things to think about, right? Coaches ask good questions. So, brushing several times a day, maybe after every meal, rinsing after a meal. When I was growing up in India, there was this underlying rule. After every meal, you go and you do kula, which is another word of rinsing, and you take out the debris. You cut down the acids on the teeth. So maybe that is something one to consider. And flossing once a day. This is my son learning, we had taught him how to rinse. And we use actually, we use vegetable dyes to put into the water, and he would spit out into the white sink, and that's how he learned how to rinse. So, rinsing after meals could be very helpful. I'm just going to go forward. But we think of candy. People say my children don't eat candy. We brush several times a day. We think of only that causing dental issues. But mouth is a gateway to wellness, not just illness. I think of it as wellness. Shows us so much more than just cleaning the teeth and avoiding cavities. Nutrition. Here's one of my beautiful families. I love this family that had come in after COVID or during COVID. I don't know whether we are in COVID or not. I keep losing sight of that, but this is what the mouth looked like. And there was bleeding. For a moment, I thought that this could be anything. It could be blood dyscrasias. It could be an infection. But this beautiful mommy described the diet and the difficulty she had experienced during the pandemic, and that the diet wasn't the greatest. And so we added some vitamin C and other supplements, and it was incredible how his mouth changed, how these areas just reverse and normal. So, the mouth is a gateway to wellness. We can see so much of what happens in the rest of the body through mouth. Today, we are studying sleep apnea and airway centered dentistry. That's what we are studying at our practice, and how our lips are together. That closed mouth posture is so important in overall wellness. Subject for another lecture. And by the way, this is what it looked like after. So in closing, I would love to share this slide. This is my family, my two beautiful angel mother and mother-in-law are not here in this picture, but that would complete my family. This was the day when we took my daughter Sophia to her college. She's now in her first year dental school, completing her first year. But this was the day we were leaving her. And I had so many thoughts because I had one child, her older sibling, not being able to go to college. But here I was dropping off my daughter, and I felt like I had spent all those years preparing her for this moment. So preparing our children is really important, because transition of care to adult services is going to require that extreme preparation. I thank you for your time. And I can tell you, although my journey started very dark, very lonely, very shameful, I am honored to be a parent coach. I have learned the most from being his teacher, and he has given me character strengths that I never even thought I had. And I am so, so honored. So thank you for your time. Thank you.
Purnima, very nice presentation. I think we learned so much about your story and the experience you had as a parent, and also all the skills that you realize and could be really transferable to not just a dentistry, to any other discipline. I think parents will benefit from your presentation. We asked them to stay a little bit longer if they could, so we can have a little bit of an interaction between you and the audience. So I'm going to read out loud some of the questions that were posted here.
Thank you.
And we'll start with Lakeisha. She said, hello, my son has gotten cleanings and brushes after every meal with non-fluoride toothpaste. How can I help with decoloration since he does not understand how to rinse and spit?
Discoloration.
Yes.
So he has discoloration because he's not able to rinse and spit, and she thinks it's from the toothpaste.
Well, my son, she says, has gotten cleanings and brushes after every meal with non-fluoride toothpaste. Let me see if she has other. He uses non-fluoride toothpaste. So it might be what the question would be, Lakeisha, if you can tell us why you use non-fluoride toothpaste.
So I'm thinking that it could be that maybe the parent is trying to get the child on a fluoridated toothpaste, but she may be a little concerned that because he's not rinsing and spitting, that
Okay, this was suggested by the dentist to use non-fluoride toothpaste.
yeah.
He's not able to spit, he swallows.
Mm-hmm. And the question?
So I think her concern is the tooth decoloration. Because he does not understand how to rinse and spit. Is that a concern that you have, Lakeisha?
Usually, I don't know about the discoloration from the toothpaste. I don't see a toothpaste causing that. But if the question is how to teach a child to rinse and spit, I'm just going to go back to a couple of slides because this one, okay? Lakeisha, I hope you're on because I'm going to play this entire video and you'll see what happens. The way before I play the video, my son did not spit. And this comes up a lot in my practice. How do you teach a child? First of all, the child needs to have some readiness skills, right? So they should be able to stand maybe or sit properly. I used to fill a cup. You can even get a see-through plastic cup. So, and put a little bit of vegetable dye, let's say a color in it, because I wanted to make the connection between the fluid in the mouth when it pours down onto a white sink. So don't do it in a sink like that. If you do a white sink, they can see the color. It's almost cause and effect. And so I would take the cup and put some fluid, colored fluid, into my child's mouth when he was younger, and then I would very gently bring his head forward and let it flow out, and I would label it, oh, you're spitting. And over time, I can't even tell you how many countless events or trials that he really learned how to do it. So let me play this. This is him now.
Thank you, Narayan.
So I know it seems very simple, but it just takes a lot of trials to really teach. So I think that if you work with your therapist and maybe take some ideas from this presentation with the color showing up on a white sink, you might be able to teach your child how to spit.
Perhaps her concern is like she's associating decoloration to not using
A regular toothpaste.
non-fluoride brushing.
I don't see any correlation to that. It may be it could be other things.
Okay.
So discoloration can happen from taking iron supplements. Discoloration can happen from open mouth posture sometimes, from plaque collecting there. The plaque could collect right around the upper teeth. That can cause that yellowish discoloration. So it could be that. And sometimes people get staining. It's called chromogenic staining, greenish, orangish staining. And it
Mhm.
could be from just the oral bacteria change in microbiome from
Oh,
brushing
interesting.
habits. Yeah, from brushing
So
habits.
perhaps would you recommend her to speak about this with her child's pediatrician
I
and looking at the nutrition component or a nutritionist?
No, I
No?
would first start off with the dentist because
Okay.
we are trained in this to look for extrinsic staining and the sources of that. And
Okay.
so I would definitely start off with that. And if the child needs iron for some sort of some reason, maybe they can change the way it's delivered, but those stains come off very easily with cleaning.
Okay, great. So there's another question. How far are you? They want to know where your office is. Could I meet you? She says, my son is 12 years old. I don't bring him to the dentist because two people have told him to clean his teeth. So I do it at home. After COVID, I have not brought him.
Hmm. Well, everyone is welcome, so that's always there. um Absolutely. And you have my email. You can look up my name and it'll show up. But more importantly, I think it's really important to keep these appointments regular. The regularity of the appointments is so important, whether we have special needs or not. It is something, unfortunately, that we are not experts of teeth. And so we have to go in and really examine our oral health. And oral health is a gateway for the rest of our body. So much happens there.
Yes, definitely. Joanne has asked if this has to do with specific resources. Do we know of any dentists who sees individuals with special needs over 21 in Monmouth County area?
So I
Um,
don't know individual, but I do know Rutgers has an excellent program that Dr. Spivak runs. I know
mhm.
that NYU, which is a little further away from us, has opened up a very beautiful clinic that serves. It's gorgeous. It's just made for that. And then I think St. Joe's also has a program for older individuals.
Yes, and I could just add also that recently through this grant, we were able to discuss the opportunity of providing a directory for kids
Mm.
and adults with special healthcare needs through the New Jersey Family Care Program. So it serves if you have that insurance or if you don't have that insurance for your child, because it will provide you a list of dentists who are serving kids and adults with IBD. So we'll send that out. If you have any questions, definitely you can reach out to us and we can direct you where to find that. And so I think that has been one of the key components of our grant, being able to put that together through the state Medicaid office. So I think parents will benefit from that.
That's awesome. That's really great.
Great. So I don't see any more questions right now, and we're almost 7:40, and really appreciate everybody joining us and listening to Dr. Hernandez. I think beyond, as I said, dentistry, we all learn a lot. I was wondering that perhaps this should be really a recipe for all parents, not for those who have kids with special healthcare needs, because sometimes we rely on the professional to prepare a child for the visit, and we go in unprepared and then we suffer the consequences. So preparation, it looks like there's a great deal to do for anyone really, especially when you're scared and you don't know where you're going.
Right.
And so you provide a lot of skills and a lot of tools for parents
Thank
so
you.
they can utilize them and for their kids and for themselves, right?
Yep. And I recognize this is not easy because we are already so busy and burdened with so much to do. But, you know, for things that are very difficult, and dentistry is difficult, we're laying down, our airway is completely exposed, right? And then somebody has to go in there. Things don't taste good. So I think preparation in this area initially, and once it becomes a routine, individuals do actually pretty well. They know what to do. So thank you so much for this invitation, and I will come at the drop of a hat. You call me, and I'll be there. Thank you.
Well, we love to always have you, Dr. Hernandez. We appreciate your knowledge and your spirit. You're such a engaged professional. We would love to have duplicates and triplicates of you if we could. We could clone you. So definitely, we enjoy your presentation, and I hope our audience enjoy it too. We're looking forward to have you hopefully sometime in the next year. And feel free to reach out to her office. We'll share her contact information for you to explore the opportunity to see what she does for our kids in New Jersey. And at this time, I would love to thank you all for your patience, your listening skills, and your willingness to learn and stretching your limits a little bit more in terms of oral health, because it's such an important project and an important subject more than a project. So thank you very much, Dr. Hernandez.
Thank you.
Have a great evening. And again, everyone, thank you and have a good evening as well.
Thank you, everyone. Thank you so
Bye-bye.
much. Bye.